Welcome back. You're watching NewsX with me, Meenakshi Upreti. As COVID cases are rising in China, alarm bells are ringing in India as well. Even though India is currently only reporting less than 200 new cases daily, the new variant is getting the government and the healthcare system worried. To fight the menace, the government has approved the inclusion of an intranasal COVID vaccine in the vaccination program as a booster dose for adults. Now, NewsX has conducted a doctor's poll asking three major questions. First, will India see a large spike in COVID cases? Second, will the spike be as bad as the Delta wave? Third, should China be accountable for lying to the world again? Let's take a look first of all at the results. Okay, so this is the first result on your screens. I request my PCR team to take the touchpad on our screens as well. Question number one, should China be held accountable for lying to the world? Now, 83% of the respondents say yes, China should be made accountable. That's the response which we have been getting from the doctors. Will the spike be as bad as the Delta wave? 100% doctors say that yes, it will be as bad as the Delta wave. That's very interesting, and we'll discuss this as well. Last question, will India see a large spike in COVID cases? 14% say they can't say. Other 14.4% rather say yes, the spike will be massive, and about 71% say no, it's not going to be as big as the COVID cases. Now, what do these doctors have to say? Dr. Nitin Bhagat had to say, and I'm just going to quickly take their quotes as well. It's an important thing that we keep a close vigil on the situation in China. I would say that there is nothing to panic about. There is no need for getting too much worried. The system is very vigilant. We need to be very vigilant. As far as genomic surveillance is concerned, this is the most important part. We are doing genomic surveillance of individuals with symptoms. Dr. Anup Kumar says medium risk of new COVID strain, people should follow the mask mandate to keep safe. Dr. PSP Rao says there's not much to worry about. Dr. Vijayant Govind Gupta says we have good herd immunity due to wide exposure and good vaccination coverage. There is no need to worry. Dr. Ishwar Gilada says no need for people to panic, but take basic COVID protocol to reduce transmission. All right, these are the quotes of the doctors we have spoken to. When we look at the results are very fascinating, very, very interesting. The three questions, there is a correction, of course, as I had said earlier. The Delta question, which sounded a little suspect when I read it out also, 100% said no, it's not going to be as virulent, and that's really been the line which doctors have been taking as well. With that correction, let's open it up for a discussion, and let's bring in all the doctors, some of them who had participated in our survey and some who are joining us just now. Dr. MC Mishra, he's a former director of AIIMS. He's with us. Dr. R.K. Tulli, he's a chief physician at the Soham International Care for Holistic Medicare. Dr. Vivek Gupta, HOD Cardiology at the Apollo Hospital. Dr. Ishwar Gilada, infectious disease specialist and health expert, is also with us. I welcome all of you, gentlemen, senior doctors on this panel, starting first of all with Dr. MC Mishra. Dr. Mishra, we will be joined by Dr. Mishra very, very shortly. Why don't we first go to Dr. Gilada? Dr. Gilada, you had yourself participated in this survey. First of all, thank you for taking out time to fill out this survey. The biggest question, which is on everyone's mind, and let's make it a public service broadcast, where let's take questions which people are asking. Biggest question, is this strain going to be as virulent as the Delta wave? If not, because all of you fail and say no, it's not going to be as ferocious. If not, why so, sir? Explain in simple layman's terms, please.
See, number one, there is something called evolutionary biology. In evolutionary biology, whatever virus, bacteria, fungi or parasites are there, and their host is human, they cannot make the host extinct. So in the survival instinct is a symbiosis. You also live, we also live. Secondly, we had seen 5 major variants, out of which 3 were virulent. The initial variant, Delta variant and Omicron. Delta, when Delta came, it was highly virulent, highly lethal, but we were also caught unawares, because that time something called National COVID Projection Council told Government of India that second wave is not going to come. And we believed them, and then we have seen what kind of devastation we had. At that time, we had very poor vaccination. Vaccine was just started. So if you look at India's scenario currently, 90% of us are infected either in the first wave, second wave, or third wave. 75% of us are double vaccinated. 30% of us are booster doses, already dosed. So under this situation, and we already have Omicron, only BA.2 and some cases of BA.3. We never got BA.4 and BA.5 in a big number. And current variants which are creating problem or havoc in China or US or other countries, they are either BA.5 descendants, BA.7 in China, Korea, Taiwan and Japan, and BQ1 and BQ1.1 in US, Brazil and Western European countries. So it is like territorial authority, like gang war. In one area where there is one gang there, other gang do not come. Similarly, in India, if it is just infested by BA.2, BA.4 and 5 are not allowed. And therefore, we are not having any big problem despite BA.7 was detected in India way back in July. If that was to create a problem in India, we would have had lakhs of cases. So we will not go in China way. China has its own problem because of two faulty things. One is that their zero COVID policy, and second, this is a very poor vaccine, which is internationally shown that it doesn't give good results.
And it's a very interesting and simple analogy, gang war, by which you've explained really why this strain is not going to be as virulent as the Delta wave. Dr. M.C. Mishra, if you could come in here. Another question, a very basic question which people are asking. It's going to be an amalgamation of two questions. One, should I get a booster or not? And what about the fourth dose? It's not allowed in India. There is no way anyone can get the fourth dose because we are monitored very closely and strictly by the COVID app. But is there a need at all for the government also to contemplate and think on those lines?
Yes, I think now it's quite a long time since we all got our second dose of the original schedule of the vaccination. So it is worthwhile to go for third dose, protection dose or booster dose, whatever we call it. It will give benefit. As you know, the flu shot is recommended every yearly because of the change of a strain, as we have been discussing that, and it's a bivalent, trivalent and whatever common variants existing. On that basis, the vaccine is tweaked. Every year a new vaccine comes in. So I think it's really important that we should get most people who have not got, first of all, in the first place, any vaccine. They should get some vaccine, either Covishield, Covaxin, Sputnik or Corbavax, whichever vaccine come your way, and you can take that. If people have got 2 doses already in 2021, it's a long time now since we got these vaccinations. So booster or protection dose is worthwhile to maintain that immunity which is waning as a result of our original vaccination. So I think it will be important.
Okay, very, very interesting point which you make, Dr. Vivek Gupta. Since we are speaking of the intranasal vaccine, would you say that those who have got perhaps say Covaxin or Covishield, should they now look at the new intranasal vaccine? Because many researchers, many experts say that it could provide better immunity to the upper respiratory tract, thus giving you, of course, a better shield against the novel coronavirus and especially this strain.
There is a small study which has shown that mixing, that means those who have got Covishield or Covaxin, if you give an intranasal vaccine, it might be giving a little more immunity or other protection as compared to if you give the same one.
Okay.
I don't completely agree with this because, for example, I have got Covishield first dose, second dose, and also precautionary dose. And I would like to myself go over the same because mixing the data are in a very small study, 250 people or something, while we are talking of crores of population which has been vaccinated. Secondly, what I want to tell you is that time has come for healthcare workers and those who are above 60 to get a 4th dose. You see, I got the precautionary dose, which was a booster dose, about 1 year back. And we all know that the antibodies which are formed do not last for more than 6 months. maximum to 9 months. Although the herd immunity or neutralizing antibodies or T cell, memory cells, they can last longer, maybe 2 to 3 years. For example, I was myself got COVID. Of course, it was very mild, but I hope and I would say it's a positive thought process that I will be having a memory cells also and more protection from the long-term immunity, which is T cells and memory cells. So what I would say that there is no doubt that intranasal vaccine is a very good move and it's easily done and there's no prick, and this is an advantage to many people. A lot of people are really fearing about the prick and the swelling which comes and some mild redness or inflammation, which will not happen with intranasal vaccine. But mixing this and just jumping onto that.
Okay, so you're not in favor of heterologous, heterologous dosage. Dr. Tuli, where do you stand on this discussion? Because, when it comes to mixing of vaccine, there have been a lot of different studies. Some experts say that, a heterologous shot could actually provide you better immunity. And then there is this other, line of thinking, this other thought process which says that it could weaken the T cell memory. Professor Tuli. Okay, there seems to be an audio issue there. Dr. Gilada, would you like to take this question, sir?
Basically, if you compare our vaccine with any other international vaccine, our vaccine is much better, even better than mRNA. mRNA vaccine has a life of 4 to 5 months, and therefore those countries which are taking mRNA, they have taken already 5th dose. Secondly, the Chinese vaccine, Sinovac, is a very poor vaccine. And there are multiple studies to compare AstraZeneca, which is in India, with mRNA and with Sinovac. And it proves that our vaccine has less lethality even after vaccination, and it is a very potent vaccine. And secondly, a lot of population in India has been already infected. Almost 90% of us have infection during first or second or third. So we have a very good hybrid immunity. And lastly, the current vaccine which is introduced, which is the intranasal vaccine, is going to be a boon, because a lot of people who had little bit hesitancy because COVID numbers are down. India has not a big hesitancy. It is a relative hesitancy. When COVID numbers are low, deaths are low, people are not interested to take vaccine. And we did not push the booster dose as much as we should have pushed. So, and initially it was only for 60 plus population, then it was made below 60 population. We allowed a lot of doses to expire. So I think we need to look at, can vaccine be made available at every doctor's place, every clinic, every hospital? If every doctor can give typhoid vaccine, pneumovac vaccine, flu-vac vaccine, why can't we give COVID vaccine? So if that is made available and intranasal is already cleared,
then why not? Okay, that's a very fair point which you make. But Professor Tuli, if you are back with us, we are also discussing the possibility and perhaps the need for a fourth wave, fourth dosage. Apologies. Do you think it should become a yearly phenomenon? This administering of booster doses, because many experts say that the immunity keeps waning over a period of time. Professor Tuli? Okay, all right, Professor Tuli seems to be having some technical difficulty. Dr. Mishra, would you like to take this question, sir?
Yeah, I think it is quite likely, as we are discussing already third or fourth dose, fifth dose. So it is quite likely that as it is recommended yearly flu shot in USA and other developed countries, in India also people are taking now flu shot every year. So I think it will be the same with coronavirus vaccine also. For if there is no polyvalent vaccine which covers COVID as infection as well. So I think that is going to be the case, but hopefully we'll get a polyvalent vaccine for covering multiple viruses, and COVID would also be one of those. I think scientists must be on this job already. They must be trying, and some trials might be going on this. So we hope that such a flu vaccine which covers coronavirus also would be made available in coming times. But I think till that time that there is no polyvalent vaccine, the COVID booster or whatever you call it, we need to repeat when we are believing that the immunity lasts for 6 months, 9 months, 1 year. And in some cases, it was studied in the beginning of the pandemic that cell-mediated immunity does last forever, but in what percentage it happens, how much infection it will prevent, that data is not yet available. So I think we'll have to wait till then.
All right, and most of you are saying that the COVID spike is not going to be as bad as the Delta wave. But Dr. Vivek Gupta, should we worry about this variant at all to begin with? Because the sub-variants which are existing in India, it's the XBB variant which is most prevalent. In fact, this BA.5 variant is hardly even present in India at the moment. How much should how much should we worry about this variant which is wreaking havoc in China at the moment, sir?
There is some reason to worry, there's no doubt, because what we are contemplating and we are hoping that our immunity is better than what Chinese have. And this may be correct also because the Sinovac vaccine or other vaccine, the Chinese vaccine, did not have that great data. And the WHO, despite all those things, they cleared the vaccine within 2 weeks, while the same vaccine, Covaxin, took 17 weeks for the clearance. So we hope in a positive way that our immunity is better. But at the same time, we do not know much about the virulence of this virus. If you see on paper, so many patients are dying. If 5,000 people are dying in China with the same BF7, then and we do not have too much of biogenic analysis at the moment, how many patients are really out of 170 or 180. At the moment, positivity rate is low. And at the moment, of course, at the same time, we have a very limited tests going on. Although positivity rate is low, that's a positive point. But at the same time, we have to be cautious. We cannot just think that we have complete herd immunity, we are fully protected, we have T cells, we have memory cells, we are taking Giloy, we are taking so many other boosters. But of course, we have to keep watch, we have to keep our fingers crossed. Next few weeks will be telling us we have to take care of these flights and we have to take off our RT-PCR testing at the airport. At the same time, masking and the COVID appropriate behavior is very important.
Yeah.
We have to tell all our doctors as well as healthcare workers as well as people who are above 60 to take care of this. At the same time, they should start taking some special vitamins and immunity boosters so that we are more protected as what we are thinking as of now.
Okay, so you're right about that. Dr. Gilala, the idea of talking about the virulence or the impact or likely impact on India is not so that people or our viewers lower our guards. Masking, social distancing, of course, need of the hour, and we must emphasize and underline the same. But at the same time, what's the possibility of us seeing another wave perhaps of COVID, which is the biggest worry amidst the general public? Because many say that with multiple strains of COVID, with double dosage, with the boosters, with most of us being infected once, many being infected twice and more, our bodies have built immunity and we are at a better state than the Chinese, who had mostly been in isolation under lockdowns during a large part of the spread of the coronavirus, sir.
You see, India is definitely a better place, and there is an evidence. We believe in evidence-based medicine. We have challenged our people during the Dashera, Navaratri, Diwali. You see, the Delhi airport was like a bus adda. You see socialization, weddings, conferences, meetings going on. And nothing, there is no letter. Hardly 1,000 cases per week for the country which has digested more than 5 lakh cases a day. And it could have been 10 lakh also, but our testing was not so much augmented at that time. So during such a situation, and secondly, if we understand, there is no new variant, it is only Omicron. And because of Omicron, one was not there with us, we got 2, and then one country's got 4 and 5, we did not allow 4 and 5 to come in. So currently, whatever is happening is because of Omicron BA.5. China is a BA.5 to a 0.2 plus 1, and that is, they call it BF.7. So these are not going to affect us at all, except in the situation where in a lockdown scenario in China, they develop another new variant, and that variant is more severe or equal to Delta, then we have a problem. Otherwise, we don't have a problem. But preparedness is very important. The virus spread only through mouth and nose. So cover this area. And even if you use mask, nobody is going to question you now. Earlier, people used to ask, have you had any kind of cancer? Have you gone through any surgery? Why are you using mask? But now nobody questions. And mask prevents you from even H1N1, RSV, lot of a few viruses which are on currently, common cold, tuberculosis. So there are multiple benefits of using mask. And that is only required. Nothing else is required. And even if somebody gets COVID,
quarantine is hardly 3 or 4 days as against 7 to 10 days of Delta. So I think India is a better place, but government is wiser. They have taken decision. They have alerted people. Let us not allow those people which are infected to enter the country. Do our genome sequencing properly. Safeguard ourselves. Boost up the vaccine and also start nasal vaccine, which doesn't require even a medical assistance. They can be even self-administered. So if vaccines are taken out of ration, made available at chemist shop, at doctor's place, people will take vaccine. It's just 4 drops here and 4
Fair
drops
enough.
there.
It's an important point which you make, and as we are ending the debate, I believe Professor Tuli's network has finally been fixed. Professor Tuli, we tried to come to you earlier. Finally, last but not the least, the audio issues and the network issues which we were facing earlier have been resolved, sir. As we sign off, what is the advice which you would like to give the people? End of the day, yes, we are not seeing, a large number of cases. India is still in a decent position when we speak of the spread of coronavirus. But with New Year, Christmas around the corner, it's Christmas Eve today. What advice would you like to give the people watching the show today, sir? Professor Tuli, can you hear us, sir? Okay, there seems to be an audio issue with Professor Tuli. I did try to reach out to him. Unfortunately, those issues still not been resolved. But I'd like to thank all the expert doctors who joined us on this extremely interesting conversation. Of course, the advice coming from the side of experts and doctors is to be cautious, precaution, not panic. Mask up, ensure social distancing, especially at the time when it's a celebratory time around Christmas and New Year. That's the advice coming from the side of the panel. Thank you all for joining us.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.